Hello, everyone. Thank you for joining our joint EPI and the New School broadcast on the harsh realities of older workers in the COVID-19 pandemic. Today, we'll have 4 panelists and we'll each speak for just 5 minutes, really 5 minutes. And we'll leave some time for the panelists to discuss policy implications among each other, and then we'll leave time for you, the audience, to submit your questions, and we will answer as many as we can. I will be the first panelist. My name is Teresa Ghilarducci. I'm the Bernard L. and Irene Schwartz Professor of Economics here at the New School, and I also direct the Schwartz Center for Economic Policy Analysis and the director of the Retirement Equity Lab. The second panelist will be Richard Johnson. He is a senior fellow and an economist at the Urban Institute in the Income and Benefits Policy Center. And there he directs the program on retirement income security, on retirement policy. Kilolo Kijakazi is an Institute fellow also at the Urban Institute, and she conducts research and partners with other researchers on issues of economic security, structural racism, and the racial wealth gap. Monique Morrissey is an economist at the Economic Policy Institute, and some of her areas are Social Security, pensions, and Medicare. And we have been working together for years. This is the first time that we've been together, and we are, I think I'll speak for all 4 of us, delighted to be with each other. I'd like to share with you a broad frame of what life was like for older workers, the economic life for older workers before this pandemic, and some of the trends that we feel will be accelerated because of the pandemic. First, we are seeing that the harsh realities that older workers faced before this pandemic, before this recession, and during this terrible recession is accelerating. I first want to share our insights coming from Rich Johnson's work, where for years he's asked the question, for every year of an experience an older worker offers to the labor market, how much does that older worker get paid for that experience? We all know that older workers' wisdom and experience with an employer, with the industry, and with the occupation is worth something, but how does the market measure that worth? And the bad news here, we did our own analysis on our own data, but we used Rich Johnson's methodology. Here we're showing you the results of the analysis that answers this question: how much does an extra year of an experience with an employer pay off for the older worker? And we've controlled for everything else about the worker, whether a worker is a female, a male, a non-white or white, whether or not they're in a union, what their occupation is. So we're just isolating the rate of return of experience, and you can see the grim reality that experience isn't paying as much as it did. So there is a downward pressure on the worth of an older worker just because of their experience in the labor market. We expect that to accelerate. This result that 12 million of the 29 million older workers right now in this pandemic, in 2020, they're the ages of 50 to 60. Of those that are working and have achieved the middle class, we are projecting that more of them, even more than we projected they would be before this recession, will be de facto poor in retirement. So we're seeing an economic, social, and perhaps political phenomena unfolding here, where the middle class worker will become a poor retiree. And that should have huge implications for our society. Here are the numbers. As we'll see that 16.8 million middle-class workers, as they go to age 65, they won't be underneath that de facto poverty level. but 11 million will be, and an extra 1.1 million will be added to those ranks of the poor elderly, the downwardly mobile elderly, because of this recession. And that's our new research, that's our model. We released some of these results last week. The third thing I wanted to point out, and again, this is an issue of broad political significance. It lets us take a step back from the moment and just see what's been happening to the older worker, to the worker in America. When we emerged from the Great Depression, we instituted in the United States a Social Security system that got more and more generous. We instituted union contracts where workers and employers negotiated for pensions. We instituted a culture that said if you have a productive working life and you work throughout your life, you could have the reward of paid time off. We call it retirement. And we saw that the rich, the middle class, and the poor equally were able to have access to that period at the end of a working life, retirement. We're seeing an erosion of that as more and more older people have to work and longevity gains have been foreshortened. But worse off, and something that gives us an existential moment, we're seeing the American worker suffer much more than workers in other countries. So here I'm comparing us with our peers. The expected length of retirement time is falling for American workers. And it's falling because we're having a flattening of longevity for white women, and maybe perhaps even a decrease for men. And we're seeing the gaps of morbidity and mortality grow since about the 1980s among people by socioeconomic class. So the whole security and the life cycle of what American workers could look forward to is eroding. This recession should accelerate it. But what I want to end with is a comment on the power relationship between workers and firms. Because older workers are the fastest growing and the largest segment of the labor force, their fallback position, being able to exit the labor force into a secure retirement, has gotten weaker. That means their bargaining power has gotten weaker. That means they're putting downward pressure on the bargaining power for all workers. So this recession is a story of lower bargaining power. I want to show you that our research has been covered. These are extra reading you can do to make that point about lower bargaining power and the erosion of American workers. And I want to announce that today we've taken a page from the Economic Policy Institute and are issuing a chart book that shows the erosion of older workers' bargaining power. So now I'd like to end, and I would like to turn over the time to the next panelist, Richard Johnson.
Great, thank you, Teresa. And thank you for organizing this webinar, and thanks to your organization, the Retirement Equity Lab at the New School, and to the Economic Policy Institute for sponsoring it. Well, in my 5 minutes, what I would like to do is to dig a little more deeper into what's happening to older workers today. So I want to start with this first chart here, which, if I can, there we go. So this chart shows how the unemployment rate today is varying by age. And so let's focus on the first set of bars on the left. That's the official unemployment rate for last month, April 2020. This is a snapshot of the labor market for the second full week of that month. And the overall unemployment rate, which is not shown on that chart, the overall rate was 14.6%. It's much higher for the youngest workers, those ages 16 to 24. It was a whopping 27%. Now, high unemployment at younger ages is typical for an economic downturn, but that's especially high. But what's really unusual this time around is a high unemployment rate for older workers, especially those ages 65 and older. So in April, their unemployment rate was more than 15%. That's about 3 percentage points higher than the rate for workers 25 to 54. That's the biggest gap we've ever seen between those two groups since record keeping began in 1948. And it's very likely that the situation has gotten worse since mid-April as job losses spread from restaurants and retail outlets to the broader economy. Now, in addition, these estimates seem to be an undercount of the true unemployment rate in mid-April. They're based on a household survey, and there was a surge last month in a number of respondents to that survey who reported that they were not at work for some other reason, that is, not because they were sick or on vacation, for example. So typically, less than 1% of workers report being out of work for some other reason, but last month it was about 5%. It's plausible that other reflects the coronavirus. And when we add those cases to the unemployment rate, what I'll call the expanded unemployment rate, that rate increases to 20% overall and to 24% for workers ages 65 and older. Now, if we add underemployed workers, those who are working part-time because of slack work or lack of resources, then the rate increases to 26% overall and to 30% for workers ages 65 and older. Now, what makes these age disparities so unusual is that in past recessions, the unemployment rate increased less for older workers than for younger workers. So back in the 1980s, when unemployment spiked, we saw a big increase for workers ages 25 to 54, a smaller increase for workers ages 55 to 64, and virtually no increase for workers ages 65 and older. Now, the advantage for older workers weakened by the end of the last decade during the Great Recession, and today the relative position of older workers and those ages 25 to 54 has reversed. So what's going on? It could be that what we're seeing is a continuation of a long-term trend in which seniority-based advantages have been gradually eroding because of the decline in unions and older workers' shrinking bargaining power, as Teresa just described. But health risks are also probably a very important factor. So older workers are at greater risk of serious health problems if they contract the coronavirus. So many older workers, particularly those in frontline jobs who can't work at home, have stopped going to work. Now, across virtually all demographic groups, workers ages 65 and older have a higher expanded unemployment rate than workers ages 25 to 54. That's true for both men and women. It's true for virtually all educational groups, and it's true for blacks and whites and Latinos. It's also worth noting that unemployment at older ages is higher for women than for men. It's higher for those with less education than for those with more education, and it's especially high for Latinos. Now, what industries do account for most of the jobs lost by older workers? This chart shows by age the share of unemployed workers from the industries with the most job losses. Now, we're not showing the industry unemployment rate here, but it's a combination of the unemployment rate and the number of workers in each industry. For older workers, the big industries in terms of job loss are trade, wholesale and retail, leisure and hospitality, education, professional and related services, and healthcare. Now, just to get a sense of how high some of these unemployment rates are, the expanded unemployment rate across all ages last month was 45% for restaurants and bars, and it was 55% for other leisure and hospitality establishments. Now, job loss at older ages is concerning because older displaced workers are less likely to become reemployed than younger workers, and when they do become reemployed, they tend to suffer larger wage losses. This has been true in previous recessions, including the Great Recession. So during the Great Recession, 18 months after job loss, 41% of displaced workers had become reemployed. Only 41%, more than half did not become reemployed within 18 months. That's compared with 78% for displaced workers 25 to 49. And among those who found new jobs, the median loss in monthly earnings, comparing earnings on the pre-layoff job with earnings on the post-layoff job, the new job, was 47% for workers ages 62 and older, compared with only 11% for workers 25 to 34. So many people accumulate most of their retirement savings in the years immediately before retirement, after they're done raising their families and paying college tuition and making mortgage payments. So these job losses matter, and the financial implications will reverberate into retirement. And now I'd like to turn it over to Kilolo, who is going to talk more about some racial disparities.
Thanks so much, Rich. I'm going to jump right in. So prior to the onset of the COVID pandemic, workers of color typically faced higher rates of unemployment and were paid lower wages than white workers. And too often, researchers, policymakers, the media, and the general public attribute these racial disparities to the lack of education held by people of color. But the evidence shows that structural barriers in the labor market, including racial and gender discrimination, result in African Americans facing greater economic insecurity during their working lives and in retirement. My screen is not responding. Okay, there we go. The data show that when you examine unemployment by level of education, African American workers typically face higher rates of unemployment than white workers at every level of education. The same is true for wages. African American workers are paid less than white workers at every level of education. In addition, African American workers are paid less than white workers in every occupation. The duration of unemployment is longer for African American workers, and they are also more likely to hold part-time jobs when what they really want are full-time jobs. African American women experience both racial and gender discrimination in the labor market. And the Institute for Women's Policy Research estimates that at the current pace of progress, it will take a century for African American women to reach pay equity with white men doing comparable work. As a result, older African Americans have received substantially less in lifetime wages compared to white workers. Racial and gender discrimination in the labor market affect whether workers will have access to employer-sponsored retirement savings plans and whether they will have sufficient earnings to contribute to these plans. In addition, years of work and wages are used to determine Social Security benefit levels. Consequently, benefits for African American families are substantially lower than those for white families. Even after receiving Social Security, African American families are more likely to experience poverty than white families. The COVID pandemic and the resulting economic disruptions will likely exacerbate the labor market barriers faced by workers of color. Workers of color who lost their jobs due to the pandemic and those who were unemployed before the pandemic are likely to face greater barriers than white workers to getting jobs and equitable wages during the recovery. Occupational segregation is another barrier, which results in workers of color being disproportionately placed in or steered to, some would say, service sector jobs rather than professional and managerial positions, for example. During the pandemic, essential workers such as employees in public transportation, the postal system, and home health care have been more likely to be exposed to the coronavirus. These workers are disproportionately people of color. The higher rate of infection and death for workers of color is driven, at least in part, by these structural barriers in the labor market. As a result of higher rates of unemployment, lower rates of pay, less access to retirement benefits, and increased likelihood of exposure to the coronavirus and the subsequent loss of income for their families, workers of color and their families are at greater risk of economic insecurity in retirement. So I'll stop here and I'm going to turn it over to Monique.
I'm going to talk about the policies that have been taken to date to push back against the recession or the impending recession. And the title of my talk is "This Time It's Different," which refers to what Rich has mentioned, which is that older workers are usually shielded from unemployment during recession to some extent, and this time it's different. I'd like to think it might also refer to an effective policy response. What we know about the Great Recession is that even though the fiscal stimulus was insufficient and the recovery was much slower and dragged on for a lot longer than it needed to, and this had repercussions, especially for older workers who have much more difficulty in getting reemployed. The initial response to the COVID health and economic crisis has been very strong. Despite glitches in implementation, the relief measures in the CARES Act have helped older workers. These include direct payments to households, expanded unemployment assistance, helping small businesses keep employees on the payroll, and supporting short-term compensation programs that encourage employers to reduce hours rather than lay off workers. These are all very effective and very good measures. The last three are especially helpful to older workers. Since these workers have been disproportionately affected by job losses in the crisis, they benefit from expanded access to unemployment benefits and the $600 in supplemental pandemic unemployment assistance. As Rich has described, unemployed older workers face worse reemployment prospects after recessions. So it's important to maintain employment ties even if work has stopped due to social distancing measures. The Paycheck Protection Program does this by channeling funds to idled workers through their small business employers who disproportionately, again, employ older workers. The CARES Act also provides funds for short-term compensation programs in many states that encourage employers to cut hours rather than lay off workers. Unfortunately, many employers aren't aware of this option. While there was unusually strong bipartisan support for relief to workers and small businesses in the CARES Act, Congress and the Trump administration have so far failed to protect the health and safety of workers or address revenue losses to state and local governments. The HEROES Act, which passed the House but not the Senate, and which President Trump has said he would veto, aims to fill these gaps among others. Health and safety precautions, paid sick leave, and maintaining health insurance are especially valuable to older workers at higher risk from the virus. By allowing people to work safely, stay home if they're sick or at elevated risk, and get medical treatment, health measures make it more likely that the pandemic will be contained quickly and help minimize the economic repercussions. Another urgent problem we face is that provisions in the CARES Act begin expiring as early as July. They should be automatically extended as long as conditions warrant. This will not only help families make ends meet, but will shorten the duration of the recession. The same is true to aid to state and local governments. Unlike the federal government, state and local governments can't borrow to meet operating expenses, which is why the federal government usually increases aid to state and local governments to prevent them from slashing services, including health services that are sorely needed right now, and worsening the economic downturn. Older workers are directly affected because government employees skew older, although often their younger counterparts bear the brunt of job losses and pay cuts. At least as important is the fact that a weak public sector was a major contributor to the weak recovery from the Great Recession, where older workers were disproportionately counted among the long-term unemployed. I'd also like to put in a quick plug for housing assistance. This is another thing that was in the HEROES Act that hasn't passed the Senate yet. The last thing older Americans need right now is to double up with extended family and friends. This assistance should include temporary housing for anyone who's infectious or likely to be infectious, including frontline workers who want to protect their families. Again, protecting our health will help speed the economic recovery. As Rich has pointed out, this isn't a typical recession. We don't know how long it will last or how different sectors will fare when it's over. How things play out should shape the longer-term policy response. In general, taking strong measures now, an adequate fiscal stimulus, not reopening too soon, will shorten the duration of the crisis. For all the reasons my co-panelists have laid out, a V-shape, that is a short and sharp recession, with a quick recovery is better in general, but especially for older workers who have fewer years to work before retirement, need to save more for retirement, and especially for older work and have a hard time getting a job if they lose them. They will also be more affected if many small businesses are permanently shuttered. Note that older workers aren't the only age group at heightened risk. As Rich has pointed out, young workers, new entrants to the workforce, also tend to be scarred by slow recoveries. Interest rates are low. Economists agree across the board that there's no reason not to borrow and spend now. Importantly, this doesn't mean rushing headlong to reopen the economy. Instead, we need to shore up household incomes and maintain distancing measures as long as necessary to contain the virus. If not, we'll be endangering workers, especially older workers, and the general population. Forcing workers to take unnecessary risks is not only cruel, but counterproductive. There's no trade-off between the long-term health of workers and the long-term health of the economy. So we don't know how long or disruptive the crisis will be. Two other factors that are hard to predict are whether there will be significant long-term health problems associated with the virus and whether employers will illegally discriminate against older workers in rehiring. Extending robust unemployment assistance as long as necessary will not only help older workers who aren't rehired, but by making workers of all ages less desperate to find jobs quickly, it will improve the odds that employers will want to employ older workers who are eager to come back. And with that, I will turn it over to back to Teresa.
Right, we're going to use this time to just to summarize the policy implications of what each of us have said. I have three. The policy implications for the lack of bargaining power among older workers is a stronger fallback position. What would help older workers comfortably offboard the labor market is if the Social Security were more comfortable and was livable. So we are calling for resurrecting, it was Elizabeth Warren who proposed, and lots of other people, a $200 increase in Social Security benefits right now. That would go to everybody, but it would affect people at the lower income much more proportionally. And that means that the older worker who is afraid to go to work, who can't go to work, who has been pushed out of the labor force will have a fallback position. That will help other workers and even themselves negotiate for higher wages, better working conditions, and better hours. The second thing that we should do is to implement a universal pension plan for all workers. Almost half of older workers don't have anything but Social Security. Having a universal pension system for all workers would help older workers coming up to retirement age exit the labor market more comfortably, or have a better fallback position in which to negotiate better wages, hours, and working conditions. The third thing that we should think about is to lower the Medicare age to 50. That allows older workers who are pushed out or forced to be in unsafe jobs an option. They could leave the labor force or go between jobs without losing their health insurance. Anybody else? What are your top line policy implications given our statistics today?
Well,
Logo?
as we develop policies for recovery from the pandemic, it is essential to eradicate racial and gender discrimination in the labor market. If not, we will perpetuate inequities that will continue to leave workers of color and their families at risk of economic security in retirement. In addition, numerous organizations and commissions have proposed changes for the Social Security program to improve benefits and to strengthen the program's financing. The basic minimum benefit was proposed by the Commission for Retirement Security and Personal Savings, and it would give beneficiaries who earn low Social Security benefits a supplement on a sliding scale starting when they reach full retirement age. This proposed policy is projected to close the Social Security income gap between African American seniors and white seniors in the bottom income quintile by 2065. And poverty rates would fall by 47% for African American seniors and 41% for white seniors compared with rates under the current law. These estimates are based on microsimulation done at the Urban Institute by Karen Smith. Caregiver credits for up to 5 years have been proposed for parents either out of the labor market or workers or working part-time due to caregiving. Such benefits are particularly important in light of the pandemic. Projections by the Social Security Administration show that in 2050, 33% of African American workers and 20% of white workers would receive higher benefits. In addition to improving benefit adequacy, it is necessary to strengthen the Social Security program's financial health because Social Security is facing a long-term financial shortfall. One proposal is to gradually raise the maximum amount of wages that are subject to the Social Security payroll tax. Currently, workers are required to contribute payroll taxes on earnings up to almost $138,000. Workers who earn less than that contribute payroll taxes on all of their income, all of their earnings, but workers with the highest earnings only pay tax on a portion of payroll tax on a portion of these earnings. So this proposal would substantially increase the share of high wage earners contributing payroll taxes on all of their wages, and it would improve equity.
Yeah. Rich, your top line policy implications.
Yeah, thank you, Teresa. So I think there are kind of two things to think about for older workers. One is, how are we going to help them meet their needs today, and how are we going to help them in retirement? We know that the pandemic and the related recession is not only going to affect older workers today, but those impacts are going to linger into retirement because they're not going to have as much time to recoup the retirement savings they lost, the earnings they lost before retiring. So in terms of their immediate needs, what I think is just absolutely critical is to, echoing what Monique said, is to both extend and enhance unemployment benefits, particularly for older workers. Older workers, not only have they may have lost their jobs, but then many of them are afraid to go back to work for health reasons. And so I think the typical kind of fiscal stimulus that in the past we've tried to use to revamp or to turbocharge the economy and to get demand up so that workers can find jobs is not going to work as well for older workers until there's an effective treatment, until there's an effective vaccine, because their health would be jeopardized. So I think extending unemployment benefits, allowing workers, particularly those, let's say, over 60, over 65, to get benefits, extended unemployment insurance benefits is absolutely critical. And as Monique told me, and also her colleague Michelle Evermore at EPI, the state of Texas has already done this by allowing old age, allowing if you're 65 or older, being a reason for not having to go back to work and yet still being able to collect unemployment insurance benefits. So I think that's really critical. Thinking to the future though, how can we try to protect retirement benefits for older workers, particularly those who've lost their jobs? And we know that these job losses are concentrated among low-income older workers. And so for those folks, I think what I really want to do is to improve the progressivity of Social Security, really, and I think the best way, the most targeted way of doing that would be to create a meaningful minimum benefit. We have scarce resources. I would think we want to be leery about giving too many additional benefits to higher income folks. But if we had a minimum benefit, those additional resources would be pretty well targeted to those at the bottom of the income distribution, those who really need help the most. And then I just think this is we have this problem of age discrimination. We know that the enforcement of age discrimination rules is weak. We know that recent Supreme Court decisions have made it harder for plaintiffs to prove age discrimination. There's bills in Congress to address that, to make the intent of the Equal Employment Opportunity Act and the Age Discrimination Employment Act, rather, more meaningful. And so I think if we did that and just made it more clear what the age discrimination rules are, make it easier for those rules to be enforced, that would help older laid-off workers get back to work.
And Monique, you had a lot of policy recommendations. If you could do 2 or 3, what would be top of the list?
Sorry, I'm trying to share my screen here. You
could just tell us.
All right. So what I want to focus, first of all, I agree with everything that everyone else has mentioned, and especially I think the most important single thing for retirement is both targeted and across the board increases in Social Security, and also paying for them. We do need to shore up the program. But what I want to focus on is what we need to do to make sure that older workers can safely return to work, the ones who want to work. I want to make sure that the ones who don't want to work anymore also have options. And I think that in general, when helping older workers, the best thing to do is help all workers and help at-risk workers, and this will tend to also help older workers. Targeted things for older workers can sometimes backfire, although there are exceptions to this, and we might want to consider some. As Rich pointed out, we need to err on the side of keeping up unemployment assistance, especially the extent of the pandemic, the robust and more expanded unemployment assistance as long as possible, err on the side of that. We don't need to be worrying about work disincentives anytime soon. Even if some low-wage employers are complaining, that's their problem. It shouldn't be ours. And we also need to make sure that the small business and public sectors don't drag down the economy for the reasons that I mentioned. Short-time compensation is everybody's favorite program for older workers, but very few employers are aware of it. So we need to really make employers aware of it. And also in the states that don't currently offer it, that they should expand it. So some states are already doing that. The sort of small bore thing is, and this was in the HEROES Act, is the earned income tax credit currently sort of discriminates against workers without children, and we should temporarily or even permanently make it as robust for workers without children as workers with children. As Rich pointed out, we need to enforce age discrimination laws. Another thing is the health and safety things are especially important for older workers. And I mean, OSHA, the Occupational Safety and Health Administration, has really been derelict in its duties during this pandemic. And the AFL-CIO has actually sued OSHA to force them to issue a temporary standard. I mean, I think that's a no-brainer. Older workers shouldn't be forced to return to work as long as it's unsafe. As Rich also pointed out, and I want to mention that the person who flagged this was Michelle Evermore, who we wish worked at EPI, but actually works at the National Employment Law Project, but we work very closely with them. And she flagged the fact that Texas is a model for other states in explicitly allowing age to be a factor in allowing workers to turn down jobs if they feel that they're unsafe and still collect unemployment just during this pandemic. Again, this could set a bad precedent and might actually cause employers to discriminate against workers under normal circumstances, but in the current circumstances, having age be an explicit factor in turning down job offers, I think is wise. And we might even, Texas did it for workers who are 65 and older or who live with somebody 65 and older, which probably includes a lot of workers who are not quite 65, but other states should consider it, and maybe also at younger ages, not just 65, because we know it's not something that happens exactly at age 65. Workers in 60 are also at higher risk, at 55 are at higher risk. And last but not least, I think jobs programs need to be, if there are some, if this really drags on and we need to do something like that, there's a lot of good things that we could be doing. And one of them is hiring contract tracers, which has already started. Just want to put a little pin in the fact that when you look at job hiring posts for these contact tracers, who are the people who will call from home, so it's a safe job for older workers, other people to ask them who they've been in contact with, people who have been infectious people, and tell them, and contact the people they've been in contact to warn them and get them tested. That a lot of these jobs needlessly require that people have bachelor's degrees and other things that will tend to discriminate against older workers. And I just want to say that if we emphasize work experience over formal education, we might get a lot of older workers in safe jobs through that. Thank you.
Oh, that's really terrific. I heard a common theme with all four of us is that we definitely want to expand unemployment benefits. This is no time to cut anybody's unemployment benefits, even the extra $600 per week. We should look at the states, Texas, that are using age as a particular reason, a specific reason to refuse work, and then you stay eligible for your unemployment benefits. We are very concerned that OSHA is not making workplaces safe for anybody, but especially older workers. I want to just clarify among the panel. We know that older workers aren't any more susceptible to get infected, but if infected, they are much more at risk of getting terribly ill. So I just want to make that clear. So when we talk about older workers going back to work, it's the impact of an infection and an exposure that we are concerned about. I'm also hearing that all four of us want to expand Social Security, and we want to pay for that expansion by raising the cap. I think I heard that from Rich. Is that okay? If not, at least three of us. We want to expand, but also pay for Social Security. So make work safe, increase the unemployment benefits, especially for older workers, but make sure they're there for all workers, and to expand Social Security. Now I'd like to turn to the panelists to ask the questions from our audience. We have many. One of them was the concerned about the gender inequity that the COVID recession is happening, that going back, stay-at-home orders has caused an overdrive economy among female labor, unpaid care labor. And many of the people who are women who are caring for people are older. Any policies for unpaid labor do you see in among all the constellation of policies? Kilolo.
So the caregiver credit that I mentioned, that proposal to provide Social Security credits for people who are at home or out of the labor market altogether, or maybe have cut back on their hours, or maybe changed to a job that is paying less because it's less demanding, that they have caregiver credits that would allow them to receive higher Social Security benefits when they retire than they otherwise would have.
I'm seeing two questions here for us economists that are coming back to the same core uncomfortable truth, that any employer that wants to hire an older worker may face increased costs because of the increased risk that an older worker takes when going back to work. Will this make age discrimination even worse?
So I do think that the challenges that older displaced workers have historically faced in the labor market, their low reemployment rates, is probably going to be worse this time around than in the past. I think it's a combination, as you said, of not only older workers maybe themselves being somewhat reluctant to go back to work, some of them being reluctant to go to work because of the health complications they might face, but also employers wondering about the types of risks that they face, and also the fact that this worker might face long periods of absenteeism because of the health consequences. So I think that's one of the additional complications we face this time around, and why it makes this recession that much worse for older workers than normal.
On that point, does teleworking make sense for most older workers? It sounds great on paper, but is it a relevant option for most older people who are working now or who are looking for reemployment? Yeah, Monique.
Hi. Well, actually, my colleague Elise Gould has written about this, and older workers are less likely to have the kinds of jobs that allow telework. And also, we talked earlier about the caregiving, care jobs, care occupations that are female dominated, and these obviously are not telework friendly jobs. And so I think that the key thing here is we need to have robust health and safety protections. I also think it's really important to remember that yes, it's possible that the long-term repercussions of COVID for older workers will be bad. But under normal circumstances, contrary to people's, the idea, older workers actually don't tend to take more leave because they don't have young kids at home who pick up every cold in the elementary school. So I don't want to, by saying that there might be discrimination this time around, reinforce myths about older workers that are actually not true. Older workers are very steady and reliable workers, and I think it's also really, really important, to, as Rich mentioned, enforce the age discrimination, and also give older workers who are still sick or scared to come back an option in the meantime while the virus plays itself out.
Do employers need a carrot to hire older workers? Should they get a tax break for hiring workers over 50? Rich?
So that's something that comes up during recessions. and never actually goes anywhere.
How come?
Yeah, I mean, I think there are some questions about the equity of doing that, and I think it's worthy of more thought and investigation. I'm not sure I would recommend it at the moment, but I do want to actually echo what Monique said, which is in fact that there is a lot of this concern about how older workers, how their healthcare expenses are higher than for younger workers, and not only is their absenteeism lower, their healthcare costs are only slightly higher, but it's almost negligible. So that is one of those canards out there that suggests, one of the reasons why employers seem reluctant to hire older workers is not really valid.
Yeah. Anybody else on this? Tax breaks for employers?
Actually, I just want an indirect way. So as a general rule, there have been very small targeted programs to encourage employers to hire older workers. And like, for example, in nonprofit sector, so, at-risk older workers, these are tiny, tiny programs. They don't do any harm. They don't do much good either because they're so small. Generally speaking, if we're talking about giving one group of workers a leg up, it comes at the expense of other workers, and it can be divisive. So what we want to do is look at ways of removing obstacles. For example, with the EITC, the obstacle to childless workers getting the EITC is one example of removing an obstacle rather than giving one group a leg up at the expense of others. One other idea that's been thrown out there and might be worth, is also lowering the age of Medicare and also allowing employers to put workers on Medicare while they're still working. So, I mean, obviously, I personally am a big fan of not having employer-based health insurance, but having, removing employers entirely from the equation. But even if we were to do it incrementally, expanding Medicare in a way could also encourage employers to rehire older workers.
We have time for one more, maybe two more questions, but this question is exactly on that point, Monique. Employers have to pay more if they have an older workforce. It's just the way that insurance companies charge employers for health insurance. The UMass Boston Elder Index shows that older workers are really concerned about healthcare costs. Even if they go on the exchange, they have to pay more. So perhaps we have a consensus here among the panel that one, lowering Medicare age to 50, and two, allowing employers to automatically put their older workers on Medicare may make that older worker cheaper, and it also, by lowering the Medicare age, make healthcare for older people cheaper. I'd like to do a round robin with all of us, just even though you might have not done research on this area, given your experience in the research area, does that make sense to you? Kilolo, first.
Yeah, it makes a lot of sense. Older workers, as I don't know if it was Rich or Monique pointed out, are dependable in their experience, and they, I used to own a business, and what I learned was if I brought on older workers, they stabilized the business. They helped to train the younger workers who were coming in, and when there were ups and downs, they could smooth things out in ways that a younger workforce might not have known how to do. So whatever steps can be taken to make it easier for older workers to be hired, if it's making them eligible for Medicare at 50, I would be all in favor. So,
Rich.
Yes, trying there. So certainly I would be in favor of allowing older, or let's say people as young as 55, maybe 50, to buy into Medicare, to make that an option. Given Medicare's fiscal problems, I'd be a little wary of just extending the coverage to so many more people. But I think allowing people to buy in makes sense. And in terms of changing eligibility ages, I think an important issue, or an important thing to consider, is lowering the eligibility age for SSI, the Supplemental Security Income Program. So this is for very low income people. It's available if you're disabled or if you're as old as 65. If we were to extend that, let's say to 62, that could help the most vulnerable workers who are out of work.
That's really good policy. Monique. I think I know your views, but
I couldn't agree more with Rich about SSI. I mean, and I would even add to that that we need to increase the amounts. I mean, the program is too small and too strict, and we need to expand that. As far as, yeah, I mean, I'm in favor of Medicare for all, or not just Medicare for over 50, but whatever we can pass in the meantime is, I think is really important. I also want to put out there, my sister-in-law is an HR manager for a small company, and she said she was expecting that some employers, small businesses like hers, not hers, they're actually very benevolent little employer, but that other employers may end up discriminating against older workers, not just because of the benefit costs or the perceived benefit costs with sick leave that are actually completely wrong, because they're not more expensive to insure for sick leave, but also just because older workers tend to be paid more because they have more experience. And that's one of the reasons why older workers have a hard time once they've lost their jobs getting rehired by another employer, is that the experience with the first employer might not translate well to the second employer. And so in a way, if we make it cheaper by providing Medicare to younger workers and giving, that's an indirect subsidy to employers who hire these older workers, we kind of offset that problem. And so I think it's really good. And now is as good a time as ever, because the medical crisis, I mean, the healthcare crisis is as big as the economic crisis.
Okay. We promised our participants, and thank you all for helping the participants, the people who have joined our webinar. Thank you to the panelists for helping the participants. The participants want a lot. There are a lot of really good questions in the chat room, and we will, you all in the audience, try to answer each of them. I want to tell you that the Economic Policy Institute, but the SCEPA, my institute, is issuing a chart book today that will have many of these numbers in the chart book, and will tell the story of the declining bargaining power of older workers, and suggest policies right now that we can implement to increase the power of older workers and all workers. Much of this depends upon the fallback position, the retirement income, and the health security increasing. Thank you all, and I hope we do more of these. It's good to see Kilolo, Monique, Rich, us being in the same place. I hope this happens a lot more. Thank you.